Okay, this is TikTok. Okay, so YouTube is live and TikTok is live. All right, let's start because people will usually just join. They will just join as they will join as they'll watch it later. So we're not going to wait for
Yeah,
people to join. I'm trying to do this.
that's fine.
Okay, position this. All right, good evening, everyone. My name is Dr. Chandus. You're welcome to today's live. Before I go on to introduce my my very qualified guest, let me just welcome us to. Okay, so I've gotten it. Okay, so let me just welcome us to today's live. My name is Dr. Chandus, and on my channels, on my profile, social media platforms, I provide health information to help you make better decisions. And in the last few months, I have tried to niche down to maternal and child health because that's primarily where my interest is. So, and that's it for introductions. Why we're here today. So, like we've been advertising, today we are going to talk about diabetes in pregnancy. Dr. Tabat, good evening. We have plenty people are joining. Dr. Tabat, good evening. Good evening, official Vani. You're welcome to the live. So we advertised that we're going to discuss diabetes in pregnancy, essential tips for mothers. So I have with me Dr. Anidi Ugu Adeze. She's my very good friend and colleague of many years. I'm just going to read her citation before we go on to talk about what we want to talk about today. So she's a consultant physician with expertise in endocrinology. So an endocrinologist is a doctor that specializes in hormones, right, Dr. Ada? Hope I've not messed it up.
Yeah, great.
All right. So
Yeah.
she has expertise in endocrinology. The people in the comment section are just, Dr. Tabat, you're not my boy, you're a big boy. You're in Saudi. So expertise in endocrinology, diabetes, metabolism. She has spent the last 10 years engaged in the care of those living with diabetes mellitus and has passion for obesity related conditions, sexual health, and preventive medicine. She's involved in health advocacy for non communicable diseases and has done this through the collaboration of NGOs and creating community awareness via radio talks and health promotion programs. So she's really qualified. Please, you guys should help me welcome Dr. Annie Dugu. I call her Dr. Ada. You're welcome to the
Yes,
channel.
Dr. I'm excited to be on your program.
Thank you. So, for as many of us that are joining us on TikTok as well, today we are going to talk about diabetes in pregnancy and essential tips for mothers. So, we'll start from the basics, Dr. Ada. We'll start from diabetes. What is diabetes? Before we begin to go into the big stuff, right? What is diabetes, and then what is diabetes in pregnancy?
Okay, so first I want to say thank you for the opportunity. Diabetes really is a condition that has to do with a problem with a certain hormone. Like you said, I'm a doctor that
Mm,
has to do my specialty has to do with hormonal problems. So diabetes has to do with a problem with insulin. Insulin is a hormone that the body secretes, and when we eat, the food is broken down to glucose, to fats and proteins, and then it's taken down to the organs and to the muscles that require them for energy. Now, when there's a problem
okay.
with the secretion of this insulin, or when there's a problem with the body's ability to detect this insulin, comes with chronic hyperglycemia. What that means is that there are high levels of glucose levels in the person's body.
Okay. Okay, thank you. Hello, Joanne. Hello, everyone that is here. Thank you for joining. Dr. Ada has just told us, or Dr. Anidi, I'm sorry, I'll have to stop calling you Dr. Ada because this is a formal thing.
Well,
So, Dr. Anidi just told us what diabetes is. So, the next question I'm going to ask her is what is diabetes in pregnancy? We've talked about what diabetes is. So, let us go on to talk about what diabetes in pregnancy is.
okay, so diabetes in pregnancy is a type of diabetes that presents particularly around the time when someone or a female becomes pregnant. Now, in terms of the nomenclature, there are some people, there are some semantics to it. So there are some people or some females who have been diagnosed to be diabetic, and they have now found themselves to be pregnant. That is
Okay.
diabetes in pregnancy. Now, when an
Okay.
individual that was not diabetic before, never diagnosed to have this problem, now gets pregnant, and during the course of this 9 months journey, now finds that they have diabetes within that pregnancy, is called gestational diabetes. Whatever may be the case, it's still diabetes in pregnancy, and it still needs to be sorted out.
Okay. Okay, thank you for that information. She has just told us what diabetes in pregnancy is. She has also told us what diabetes is. So these are just, like a build up to where we are going. So how can you know if you have diabetes? What are the signs and symptoms? What are the things that will let an individual or a pregnant woman to know that she has diabetes in pregnancy?
Okay, so a female that is pregnant, usually over time, they usually have the irritation of the bladder, so they are prone to having frequent urination or the urge to urinate all the time. But some of the symptoms that can come with diabetes mellitus include excessive urination. So oftentimes
Okay.
the individual that is pregnant may not even detect that there is a problem because she attributes the frequent urination to the pregnancy, the condition itself. But in addition, they
Yes.
might also find that they are also very thirsty. So there's always a certain craving to drink a lot of water. They might also find themselves to be nauseous or to be vomiting. Now, remember again, Dr. Chandus, these things are associated with pregnancy as a condition itself. So oftentimes they might not detect it on time unless there is a
Mm,
healthcare professional they have to see to detect it.
okay. Okay, thank you for that. She has just told us the signs and symptoms of diabetes in pregnancy. She has also told us that it can be difficult in public health. We call it confounding because the symptoms
Yeah.
in pregnancy may resemble that in diabetes. It might be a bit difficult to tell the two apart, and that's where an expert can come in. Okay, so let's move on. Now, how common is diabetes in pregnancy? Is it really common? Is it something you see a lot? And is it if possible, can you tell in terms of statistics how often you see women coming down with diabetes in pregnancy?
Okay, so currently, this is outside of diabetes in pregnancy. There are almost 500,000,000 people that have diabetes. That is one point to note. So there are quite a number of people in the world that are currently living with diabetes, and we have over 24 million people even in Africa alone. Now, when you hone down to the females who have diabetes in pregnancy, you have 1 in 250 pregnancies. So, what that means is that out of 250 females who will become pregnant, one of them will probably have gestational diabetes. This means that a
Wow.
lot of women will have the problem of diabetes or problems with their glucose levels during the course of the 9 months journey for pregnancy.
Okay. Now, it might seem like, as she has said, is it 1 in 250, right? Now, it might seem like,
150
sorry,
more.
one
It might seem very small, but it's actually not.
It's a lot, yes. Especially, I will always talk about the public health dimension. It might seem like a little, but it's a lot. You see,
Yeah.
that 1 in 2 is quite a large number, right? Okay, so thank you. She has just told us the statistics. So we'll now go on to, because what we try to achieve with these videos is we will try to make it useful to our target audience. So beyond the grammar and the book stuff, you know, we try to make it relatable to our target audience. So the next question I will ask is, for a pregnant woman, how can diabetes affect a woman who is pregnant and has diabetes? Either
Come again with the
diabetic
question.
before Okay, so how can how can diabetes affect a woman who is pregnant? How can it affect her pregnancy and affect the baby
Oh,
and affect the woman? Both for a
okay. So,
diabetic woman who becomes pregnant and for a pregnant woman who develops diabetes in pregnancy.
okay. So there are a lot of problems. So just like you said earlier, 1 in 250 might seem very small. But now remember that that is for gestational diabetes, for women that were not diabetic before, but during the course of their pregnancy were found to have problems with their glucose control. Now, add
Yeah.
that number to the number of women who already have diabetes who become
Mm,
pregnant. And then you now find
mm.
that they are much more in number.
Oh dear. Is it network? Is it my own network? I'll stop hearing her. Okay, I wasn't here.
So, with
Yeah.
particularly for the woman, for those who are diabetic who become pregnant, you might find that one, their glucose control becomes very disordered. And that really is
Yeah.
because the pregnancy as a condition. Now, I'm not talking about the pregnancy as a disease, but the stress or the burden of pregnancy itself on the female kind of puts a strain on the function of that insulin, the hormone that is responsible for taking care of glucose. In addition to this, you also have problems of blood clots, which can form throughout that 9 months journey. So these women that are diabetic can actually have the formation of blood clots.
Network is just going up and down. Lost you for a minute. I can hear you now. I lost you for a minute. We're talking about blood clots. Is it embolism? Do you mean embolism?
So the formation of blood clots,
Yeah, network is dealing with us. So.
yeah, there seems to be some issues with
Yeah,
the.
network is. Yeah.
Yes. So I was just saying that the formation of blood clots during pregnancy gets increased, the risk with people that have
Okay.
diabetes and are pregnant. So these blood
Okay.
clots can actually be in the legs, cause pain, cause swelling, and predispose these females to having foot ulcers. It can also cause problems in their heart, causing them to have cardiac arrest, which is the dreaded
Okay.
heart malfunction. You can also have a blood clot going to the brain and causing a stroke. And these are life-threatening events that pregnant women should not be exposed to and should be prevented at all costs. The other things like increased risk of low sugars, because remember that the pregnancy
Increase
itself
of what? Low
of
sugars.
low sugars, because while they are being catered to in terms of trying to attain a perfect glucose control, the strain of the pregnancy itself plus the strain of taking their medications can increase their risk of having low sugars. These are the problems that the women can have. Now, when you talk about the child itself, they are prone to fetal death. So there are problems with the high levels of glucose levels that can cause the child to die in the womb or die just immediately after birth. There are also problems like chronic infections, around the birth canal that can also predispose these females or the children to have the females, sorry, to have preterm labor. And, with the attendant risk of having a bad outcome with the child coming out before the planned date, that is a problem. The other things like congenital malformations, these are just a genetical problems that the child is prone to that can cause the child to have some malformations like heart defects or kidney defects, and also will reduce the quality of life for the child and possibly the life expectancy of that child.
Okay. Okay. Hello.
Yeah,
Network is just bad. We'll just be
yeah.
coasting. Okay. Us that are on TikTok. You're welcome to the live. I'm also live on YouTube. That's why I'm facing this side. And on YouTube, we have an expert clinical endocrinologist. An endocrinologist is a doctor that specializes in hormones. And this evening, she's telling us about diabetes in pregnancy, essential tips for mothers. She has told us about this, what diabetes is. She has told us what diabetes in pregnancy is as well. She has also told us the signs and symptoms of diabetes, how you can know as a woman or a pregnant woman that you have diabetes in pregnancy. So for those of us that are live, we can leave our questions for the endocrinologist. and I can ask her and relate it back to us. She has also told us the complications associated with being either diabetic and getting pregnant, or being pregnant and coming down with diabetes. So that's where we are. Just thought to bring us up to speed. All right. So the next question I have for her is, um, what steps can a pregnant woman take to manage her blood sugar level in pregnancy? Now, it will be, I think this question will be two-faced, so that I'll make it easy for you. What step can the mother take? Although this life is targeted at mothers, clients, not really us, but it's also good to, to ask, what steps can a pregnant woman take, right, to normalize? I think that's the question, to manage her blood sugar when she's pregnant. And what steps can her healthcare provider also take, right, in managing her blood sugar? I hope those that are on TikTok, if you're on TikTok and you're with me, please leave a message and ask your questions. Okay. Thank you. Please go ahead, Dr. Anidi.
Okay, so concerning blood glucose control for those, so it's actually twofold for patients, particularly that are diabetic who become pregnant. They now have to be more vigilant. By vigilant, it means that they have to have a machine or a meter to be able to detect, test their sugar. There has to be a lot of monitoring and evaluation on their side. So we encourage self monitoring. Now, the female has to have a glucometer, which is a glucose machine to check the glucose levels, and it has to be done at home. Now, there we have certain targets that we give to these females that probably not to bore us with the details, but there are things that targets that we give to the females so that when they're at home, they can actually monitor their blood glucose levels. Now, there are particular times to check the blood glucose. Now, we check before the food, 2 hours after the food, and when they have signs of low sugars or signs of high sugars. Now, before and 2 hours after meals, it's because there are scientific data that gives us an idea of what the blood glucose level should be like when the female has not eaten for 6 to 8 hours. And then we now know the value at which the blood glucose should be at 2 hours after the female has eaten. Now, when it comes to signs of low sugars, there are signs to look
Hmm.
out: things like dizziness, excessive sweating, excessive beating of the heart, um,
Yeah.
shaking of the hands, things like that. When the child or when the female, sorry, has that kind of symptom, it is good to also check the blood glucose. And then when they have signs of high blood glucose levels, which we also talked about earlier on, excessive drinking, excessive urination, nausea, vomiting, weakness generally, then it is also time to check the blood glucose levels. And the whole idea of monitoring and evaluating is that you're working in collaboration with your healthcare professional. So that is supposed to be documented so that each time they come for the antenatal visit or when they come to visit the endocrinologist, we walk through the values that have been gotten at home to be able to optimize what their blood glucose are. Now, the second thing to do is drinking of water. People underestimate the value of being well hydrated.
Drink
So,
water.
particularly,
Drink water.
yes. So a lot of healthcare professionals that are also on social media platforms also encourage this, and it's really important. So you ask, how much water do you have to take? So on the average, three
Yeah, I
liters
just
of
drank my
water is.
see my water
Oh
bottle.
yeah, okay, good job. So
I'm
essentially
practicing what
for
we're
every.
preaching.
Oh no, it's so essential. So really, for every individual, about 3 liters of water every day is adequate. If you can tolerate more, why not? There isn't any danger of taking a lot more water, as much as the body can take. But we cannot overemphasize the benefit of a pregnant woman being well hydrated, because it actually helps to keep the bladder clean and well, the flow better. It also well
Mhm.
hydrates the circulation. It also helps with the blood glucose levels as well. So that should not be underestimated.
Okay, thank you so much. She has just told us what the steps what she described is a twofold, is in twofold. She told us what steps the pregnant women can take, to get their sugar levels under control, and also what the physician, her doctors can do as well. So the next question we'll ask, and which I get a lot, and I noticed that is something that that does really well on social media for those of us that create content. Are there specific foods to avoid or foods that are beneficial to a pregnant woman and her baby who have, or a pregnant woman who has diabetes in pregnancy?
Okay, I get those. I get that question a lot, and it's not something that we can trash out even in one session. But I would like to just summarize it. So, first things are, um, for women that have diabetes that now are pregnant, and for those who have been found to be diabetic during the pregnancy, there has to be
Mm.
restriction of carbohydrates. Now, remember that I
Sorry,
talked about diabetes.
question?
We have to
Sorry, say again.
restrict. Yeah, I said
Restrict carb.
that when
eh?
diabetic that becomes pregnant, or whether the
Yes.
pregnant becomes diabetic, there has to be restriction in the carbohydrate intake. It means that the
Okay.
sugars have to be and by reduction, a normal Nigerian will eat a meal that has basically about 90% of carbohydrates. That is our staple meal. That's our go-to. So if we're to
We
eat
eat a
something
lot of.
like rice, we eat a lot of starchy foods. So there has to be a restriction in that carbohydrate down to 25 to 50%. What that means is that for a plate or for a meal, the carbohydrate content has to come down to 50%, half of the plate, or 25%, one quarter of that plate. And the way that we determine how much of this carbohydrate is essential for the lady who is pregnant is by working with a dietitian.
Okay.
So the dietitian does a little bit more or takes it a step further. So what we do is to quantify. But when the pregnant lady works with the dietitian, they talk about specifics and then the time and the portions. So there has to be
Okay.
first portion control. The carbohydrates cannot just be on the plate all day with every meal because the problem is that the insulin, which is responsible for taking the glucose from where it is taken in through the mouth into the stomach to where it is needed, which is the muscles, it's not working optimally. So it means by
Okay.
implication that we have to reduce the quantity so that the insulin that is available can work very well. That's the first step.
Okay.
So
Slow
reduction,
down. Slow down. Okay, she has given us plenty stuff. I don't know if you have noticed me. I've switched to my learning mode, right? Even as a doctor, there are some things you hear that every day we learn, right? She's
yeah,
a specialist. This not area, even though most of what she said I already know, right? But you can see me that for a minute there I was caught up. So she has told us about restriction of carbohydrate. That's the first thing she has mentioned. Okay,
yeah.
the amount of carbohydrates that you eat per time has to come down. I think you said up to about 25%, if I'm not mistaken. Up to 25%,
Percent.
right?
10
Or a quarter. Hello, I'm right, ba?
Yeah, I can hear you. Yes, 25
Okay,
to
so
50%.
down to 50%. Is it 50 or
25 to
20?
50%, Dr.
Okay, so she said to
No,
25.
25% is 25% is recommended. There are some times that
Okay,
we have to increase it, so we go between 25% to 50%.
okay. So essentially, your carbs consumption has to come down. Okay, and they do this in collaboration with a dietitian. A dietitian is a specialist in nutrition, in dietary modification, dietary management, and all that. So thank you for that. So thank you. Please go ahead. I just thought to do a recap.
Yeah, so That is perfect. So it's also important to note that the dietitian we're talking about are not the self-acclaimed dietitians on the streets of our town, but they are
Yeah,
people board
on
certified,
Instagram.
particularly those on social media platforms that are self-acclaimed.
Dietitians and nutritionists.
Yeah, yes. So they walk the patient or the individual through the specifics in terms of what type of carbohydrates, how it should be prepared, what the portion size should be for that particular individual, because the food carbohydrate content has to be tailored to a specific client. And then the times when the meals are preferred. That's what the dietitians will do. Now, the second, but as a rule of thumb, what we advise is that we should not have fried meals. Dr. Chandus, can you no fried meals at all throughout months? Oh, yes, no fried meals because yeah, well, say I was trying to say that the fried meals have a lot more fats embedded within the meal. So that will also raise the calorie content. That is the amount of energy that it gives at all. Yes. So you were talking to be avoided. We need to avoid fried meals. We need to also avoid overly processed foods. Yeah. What was the question? No, okay, so overly processed foods are foods that come from cans, foods that have been on the shelf for a long time. Yes. So we want to avoid frozen meals, frozen foods, sorry, avoid canned foods, and then particularly foods that are packaged. So where you have parboiled rice and, in sachets, things like, I'm sorry for Indomie, things they're overly processed. Excuse me. Mm. Oh, there's so much more. So for those that have been diagnosed, things like smoothies, so crushed fruits. So we advocate for fruits and vegetables during this period, but we do not advocate for smoothies, that's liquid meals. So things like smoothies, crushed fruits, we don't want that. Yes, please. So as a Yes, a rule of thumb. We want the fruits and the vegetables as Jesus intended it. What that means is that as close to nature possible. Yes. The reason is because the vegetables and the fruits have a lot of fiber embedded in it. And what you do when you break them down, that is when you make smoothies, is that you crush the fibers, which are supposed to help with gut motility and gut health. And it's supposed to help with movement of, the feces out in one piece. Yes. So that whole process whereby the fiber helps with, moving out waste products out of the body becomes defeated when you now convert the fruits to essentially a carbonated drink of salts or refined drink. So we prefer it to be cut up, diced up, and eaten. Um, they are. Yeah. No, for now, until I, there are so many things to actually mention, but I dietitian will rest in. But these are the things to. Okay, this is also something that is really, really important. So we'll go in both phases. So for those who have been diagnosed to be living with diabetes, who now become pregnant, they have already been on regular medications. For this group of people, they need to first be registered early for the antenatal care. And then the obstetrician will refer them to the specialists, such as myself, to go through their medication. So we do a medication review. So after doing several tests, examining the individual, we want to optimize the glucose control for that 9 month period. We also want to take away medications that they're already on that could be harmful to the child or to the mother. So we like to stay away from medications that will increase the risk of the mother first having low sugars. That's one. So there are a particular group of medications called sulfonylureas. For the healthcare professionals, they are well aware of what this means. It's just a group of medications that have a particular side effect of causing low sugars. They're quite notorious for doing that. So when we do the medication review, we usually take away this group of medications. The reason also why we take it out is because there are no safety profiles to tell us if it is actually safe for the baby. There are some of these medications that are used to treat diabetes that could be harmful to the child. So once we identify them, we take them out altogether. Now, the third reason why we have to also see these individuals is because it's been proven scientifically that the best form of treatment for women that are pregnant and now have diabetes, either before pregnancy or during the pregnancy, still remains insulin. But more importantly, before commencing insulin, we have to walk them through what they need to know before starting or before actually continuing on with insulin if they have previously been on insulin. Because, information is really power. So they need to know the do's and in terms of the storage of the insulin, in terms of how long to keep the insulin before discarding, how to administer the insulin before we now place them on insulin. And then the last thing is we have to titrate. Yes, yes. So it's been proven scientifically that the best form of treatment for mother and baby for those living with diabetes or for those who find that they're diabetic during pregnancy remains insulin. But before we start the insulin, we have to give the client the information that is needed so that they can use it safely and it will work for in their best interests. And this information involves talking to them about how to store the insulin, how to administer the insulin, what side effects they can possibly get from the insulin, and how best to use the insulin. Yeah, no, Okay, so essentially, it's been said that there's been an association between diabetes and its effect on breast. So, for mothers that are diabetic who become pregnant, I mean, in the immediate postpartum period, they find that there is a reduction in terms of milk production, particularly for first time mothers, as you know. But beyond that, for those that have diabetes, they might have some issues at first with lower milk secretion. Be that as it may, in terms of the special considerations, it would be outside of, it would be in the context of other problems that the individual might have. Diabetes doesn't have any special consideration per se, because eventually the breast production picks up. What you might consider to be special consideration would be like, we have a certain group of ladies who might be diabetic and have things like HIV or some other um, illness that could potentially pass from mother to. And in that particular context, you might want to review what the benefit of breastfeeding might be for that particular client. But the only thing that I know concerning diabetes and breastfeeding is that it might reduce the ability or the efficacy of breast milk production. Yes. No, not at all. The one that is diabetic or living with diabetes can breastfeed with no problems. It's not that, there is also that concern that it could pass from mother to child. Not that way, not at all. Yes. Hmm. Um, that question has actually come in the past, and I wonder. Okay, so diabetes in itself is a challenge. It's a challenge because it affects every part of the human body, of the lady's body, and there is also the effect, the burden of taking the medications, trying to balance your life with your meals and the medications that you have to take. In addition to this, the lady also has the burden of having a growing child that has needs. There is no easy way to balance it except to be more intentional. So, in this case, taking your medications is not an option, because it means that once your glucose control is very good, the complications or the problems that come as a result of diabetes with someone that is pregnant will reduce drastically. It will also prevent any harm coming to your child. The also has to engage in dietary monitoring and restriction, because that is the most effective way to get to that glucose control. The whole scenario in itself, with diabetes on one end and pregnancy on the other end, is two challenges that would need some determination and motivation to be able to overcome. That's my own opinion.
It's good that you weighed in on it. Okay, so we have had Dr. Annie Dugu on our live. She's a consultant clinical endocrinologist. She has essentially discussed diabetes in pregnancy. She has told us the essential tips. In fact, there are still more questions, but remember, like we said, we're going to have volume one and volume two, because these things, when they get too long, it starts to get tiring and all that. So we're going to have another volume, right? So essentially, she has told us what diabetes is. She has told us what diabetes in pregnancy is. She has told us the symptoms and signs, how we can know, or how a pregnant woman can know that she has diabetes in pregnancy, especially if it's first diagnosed in pregnancy. Okay. She has told us how it affects the pregnant woman, how it affects her fetus. She has told us the steps that the pregnant woman and her provider need to take in order to keep her sugar levels under control. She has told us the specific foods. In fact, that is another program on its own. That's another live video on its own. But she summarized and told us some of the foods to avoid, where the focus is with regard to nutrition, what the focus is. She has also told us that it's a collaborative management with dietitians who are not Instagram influencers, not people who call themselves. It's very easy to become popular in
Oh,
Nigeria. Okay. So there are people who are actually certified, board certified, and trained dietitians. Okay. You go to school for it. Don't just wake up and call yourself one. Okay. So she also told us about medication. Will you need to take medication? Will there need to be adjustments? Will there need to be monitoring tests? And she also told us how it impacts breastfeeding, special considerations, if any. She has also told us how to balance the challenges, in her opinion, because like she rightly said, there's no straight jacket answer to that. It depends. It's a case by case thing, right?
it's
From what
very individual.
Yes. So it has been an interesting live. Let's shut down so that we do not take your Sunday. Thank you for joining us. Please share this video, this live video, because after the live, it will be on the channel. Share this video with as many pregnant women who you think will benefit from watching this video. Share the link, share the video, like this video, and subscribe to this channel for more videos and tips like this. We'll still have Dr. Anidugu back on this channel because I've even learned a lot myself, even as a doctor. My baby is preventive medicine. It's not
Yeah.
endocrinology. So I've learned a lot, which will also be valuable to me, right? People ask me a lot of these questions every time.
Yeah.
DMs, cool. All right. So I thank you once again for joining, and I
Thank
hope
you.
we'll see you next. Thank you for joining us. Thank you for agreeing to, she's very busy. Thank you for agreeing to come on here and discuss this. And we hope that when next we call you, that you will answer our call. Thank you.
Thank you. I'm excited to be here. Thank you for the opportunity as well. I appreciate that.
Thank My pleasure. In fact, the pleasure is all mine. And I'm looking forward to more collaborations like this to get more of our colleagues to share. There's a lot of false information out there. And we have the right information. So it makes sense that we should get out there and put out the right information.
I
Thank you.
totally.
Yeah. Thank you
uh,
so much once again. I can't stop saying thank you. And until the next video, the next live video, stay blessed. Happy Sunday and have a great week. Bye.